keynote speaker today is my great friend, Joe Scott, fellow of the American College of Healthcare Executive, and most recently the founder of Joe Scott Advisors. Joe has 40 years experience in healthcare. He served as an executive for healthcare quality and safety at several systems. And then he was the chief executive of 2 hospitals and 1 healthcare system in Florida and New Jersey. Most recently, he was the chief transformation officer for one of the largest healthcare systems in the Northeast, where he led the innovation strategy in population health for this very large healthcare system. And most recently, he founded a healthcare advisory company to help startups, healthcare systems in the area, and venture capital funds in the area of innovation. And Joe is one of the most knowledgeable and insightful people that I know. He's been a great friend and a great mentor to me personally. And I would not have been able to start my company without Joe's support. So I'm really, really appreciative of having Joe here today. So with that, I'm going to hand over to you, Joe, to talk about how you see the impact of the coronavirus crisis affecting healthcare systems. Over to you, Joe.
Okay. Thank you. Thank you, everybody, for joining. I'm happy to be here. I hope this is as much a dialogue as it is about me talking about what's going on with COVID and what's going on in the healthcare industry. Clearly, everybody's trying to figure out what the next steps are. And there's so many factors impacting what's going on, not only in the acute care setting, but in the health of people overall, that anyone's insight into their thoughts about how we can address some of these issues will be important. Just a little bit about J. Scott Advisors. So I started the company, J. Scott Advisors. It's really how do we make healthcare easier through innovation. I serve as an advisor to a venture capital fund called Newark Venture Partners. I'm also a channel partner with a company called Sierra, and I have several startups in innovation who are focusing on how they can make healthcare easier, mostly through innovative applications in healthcare. And so as we go through this presentation and we begin to think about it, I'm looking for those innovative technologies that might be out there that we might be able to connect to healthcare systems as we go forward. So actually someone sent a question already about, when will we get back to the new normal? And I'm not sure there's a universal answer to that question. But I did think it was important for us to talk about what it might look like as we get back to normal. So phase 1, clearly there were several areas of the country that were overwhelmed. I live in New Jersey. New Jersey was one of those areas. My son is a critical care nurse in Manhattan at Mount Sinai. And clearly he was at the epicenter of what was going on. So those areas were overwhelmed. They're worried about future effects of COVID. And when you look around the country, not everybody was impacted clearly the way some of the epicenters were. We started social distancing, and sure enough, the rate of infection starts to go down. We're worried about what happens as we open up. Will a new surge happen and where? I'm sure everybody saw what happened in the Ozarks when all those young people were partying. It's not so much the impact on the young people, right? It's when those young people then get infected and start infecting other people. So they talked about having those folks who were at that party quarantining for 14 days. Will they do that, or will a new surge happen? And how will it impact that particular region?